Before we dive into today's insightful discussion, I want to share some updates that will enhance your Fempower Health experience. We're excited to launch our new interactive newsletter. This weekly newsletter is packed with the latest scientific findings, business insights, and essential updates in the realm of women's health. Signing up is easy. Just visit our website or click the link in the show notes. Our website is also a comprehensive resource organized by topic for your convenience. Whether you're delving into the latest research, exploring any trends in healthcare, or seeking information in specific health topics, it's all there at your fingertips. Additionally, for our Spotify users, we've created playlists categorized by these topics, offering you another way to stay informed and engaged. And for those listening on Apple Podcasts, while we can't categorize content within the app, our website remains a central hub for all of these resources. And be sure to take advantage of these tools to stay on top of the evolving world of women's health, science, and business. Now let's get started with today's episode. This is Fempower Health. Each week, top women's health experts dispel fact from fiction,
The most important pelvic floor exercise is not the Kegel.
challenge the status quo,
It's never easy to challenge the accepted leaders, and especially if you're a woman.
provide perspective on why your healthcare journey may be so tough,
all of that fear and worry, it all upregulates our nervous system, puts us into fight or flight mode, and increases our pain sensitivity.
and what you can do about it.
The number one thing is you have to advocate for yourself and you have to be prepared.
Your journey to get empowered starts now. This is Fempower Health. Each week, top women's health experts dispel fact from fiction,
The most important pelvic floor exercise is not the Kegel.
challenge the status quo,
It's never easy to challenge the accepted leaders, and especially if you're a woman.
provide perspective on why your healthcare journey may be so tough,
All of that fear and worry, it all upregulates our nervous system, puts us into fight or flight mode, and increases our pain sensitivity.
and what you can do about it.
The number one thing is you have to advocate for yourself and you have to be prepared.
Your journey to get empowered starts now.
Chronic UTIs can have a similar pain cycle to what happens with painful sex, where maybe there's an initial trigger that, it's an infection, it's a trauma, something that creates that initial painful penetration. But then your muscles and your brain create this pain response cycle where you're actually developing pain preventatively in advance of penetration.
Welcome to Fempower Health. Georgie here. According to a recent study that looked at 25,000 women, it found that at least 32% have a pelvic floor disorder. It is actually estimated in other data that over 40 million women in the US alone have a pelvic floor disorder at some point in their life. However, there's only about 5,000 providers with expertise to support this. So I am pleased to bring to you Carine Carmy, who is the co-founder of Origin, which offers virtual and in-person visits for pregnancy, postpartum, sexual health, and menopause. And we are here today to be educated on what good pelvic floor function is, because so much of women's health is normalized and we aren't taught enough about our bodies. If something is going wrong, how do we know what that might be? And so we talk about what you should be expecting as you age with your pelvic floor and how best to be proactive. And if you are interested in going into depth in some of the conversations we cover today, feel free to check out my Spotify playlist by going to fempower-health/Spotify. And now let's hear from Carine. Carine, it's so nice to have you on the Fempower Health podcast. I can't believe, what was it, a few months ago in September that we met at Delphine O'Rourke's office in was it Times Square? Yeah, it was Times Square area.
Yeah.
What a beautiful space, by the way. And it was great to see you on a panel discussion talking about your expertise in the women's health space. And I actually had Delphine on the podcast right after that to talk about her perspective as an attorney on the impact of overall women's health with the overturning of Roe v. Wade. So that was a really, really interesting discussion.
Yeah.
So if anyone wants to hear back on that, certainly we agree that that blew women's health out of the water and the gaps that we have in healthcare. So I'm sure we'll be covering a little bit of your experience with that as well today. So before we dive into talking about pelvic floor health, I'd love for you to share your background and how you got to where you are today. And by the way, you're 37 weeks pregnant. So thank you so much for making time. And by the time this episode goes live, you're going to have a cute little bundle of joy. So I can't wait to get the updates. But yes, tell us your story.
Amazing. Well, thank you so much for having me. It's a pleasure. And for all the work you do to elevate these really important topics, which, hopefully in the future just become so ubiquitous that we don't even need to talk about it. But today, it requires this deep focus. So thank you for your work. So my background has been in healthcare and technology most of my career. I started as a management consultant and then have the crazy need to keep building startups over and over again. So Origin is the 5th startup I've built and been involved with, the 3rd that's venture backed and the 1st in this kind of co-founder CEO role. So I like to joke that I enjoy type 2 fun, the kinds of things like climbing mountains and building companies. But it really all cemented for me in 2018. I had spent a lot of my time in digital healthcare at various startups and had seen, the shifts of the ecosystem, but was also finding myself really disconnected from the end impact of my work, working in companies that were B2B to B2C. And, I'm like, add more acronyms between, you and the end patient. And so I decided to take some time off and moved from San Francisco back down to LA, where I grew up, and was doing a lot of actual work physically to deal with some chronic issues I had swept under the rug for a long time. I have IBD, ulcerative colitis, and I'd also had a history of about 10 years of vulvodynia or painful sex. I was originally diagnosed in my early 20s in New York, and I was going to, Cornell Med, like some of the best medical institutions in the country. And yet they, one, took a very long time to get, even the name of the diagnosis and, probably didn't even get that right in the early days. I had biopsies done, which was really counter to what is the plan of care for this kind of work. And I was never referred to a physical therapist. So, their plan of care was like, try this cream, have a glass of wine, and maybe it'll go away. And,
Unbelievable.
Exactly. Yeah. We're rolling our eyes over here if you're listening. And so it was one of those moments where I wasn't actually actively trying to, get support for this, but I connected with an old friend who's now one of my co-founders. She had just had her first son, and she was experiencing a host of pelvic floor issues, including painful sex, but also incontinence and, discomfort sitting. And she was referred to a physical therapist here in LA. And I said, wait, you can go to a PT for your pelvic floor? Like, what does that even mean? And we ended up at the same practice. And the care, was life-changing. And in 2 sessions, I finally, really understood what was going on with my body. I had a plan of care. Most of it was really non-invasive, like learn how to breathe properly, how to downtrain my pelvic floor, and actually just reconnect to my body in this very, very powerful way. It was, I say life-changing because it was not only this physical shift and obviously having a positive sex life is really incredible, but also because I finally understood my own anatomy for the first time. And, most women are not taught about, the difference between a vulva and a vagina, ever, especially at young ages.
Right.
And so that was this beginning journey for me to understand both how important this work is, but also how underserved and common these issues are. And so that was really the beginning of our origin story. My friend and I ended up partnering with that local clinic, brought in our 3rd co-founder, her husband, and have been partnering with really incredible physical therapists across the country to elevate their work and build a network of both in-person clinics, but also virtual care.
Wow, that is incredible. What a change the women's health space has been, even in the short time that I really got into it after my 4-year fertility journey. I mean, just it's exploding. So I'm excited today to talk more about pelvic health because it is certainly a popular topic on the podcast. And so for those listening, I do have a Spotify playlist where I just categorize all the topics because there's so many different things that are covered here on the podcast. And, when you and I were aligning, it's like, what can we talk about? Because, as I mentioned, as soon as I met you, I'm like, we have to have an episode together. But what new things can we cover on the podcast that haven't been covered before? And so I love your idea of, since, taking off of what you just said, which is we don't understand our bodies, but our bodies change as we age and as we experience things like pregnancy. And I am sure you're a very good pregnant woman and that you're being proactive about your pelvic health and doing all the
Trying, but
things.
still.
But let's walk through these different life stages and what women, maybe we could talk about what women should expect and what should be monitored, because we don't know what we don't know, and because we live with our bodies every day. Like, here's an example I love to give. So I dated this guy in college, and we dated for a long time after college as well. And we keep in touch. And many years after we had stopped dating, he's like, remember my nephew? He was like 5 years old and so quiet and shy. Well, you won't believe it. Apparently, he was almost blind. And that's why he was shy. But to a kid, he doesn't know, or he or she doesn't know what vision is because they're born and it's like, well, this is just what it is. And through an eye exam with school, they realized he was practically blind. He got glasses and literally transformed into this bubbly young boy. And so I always think about that. And I want to just put that to light to say, like, no, literally, like, we think it's normal, and then worse, because there isn't the data in women's health, and our moms and grandmas and aunts and sisters also think it's normal. We're kind of like in this massive pain is normal, bad is normal, sneezing and peeing is normal. And it's funny. So
Oh, I got chills as you shared that story. Pelvic health, and I'm sure this is familiar to folks on your podcast if they're, listening before, is really just another way of looking at, a part of your body, right? So we think about back health or breast health or, or mental health. And unfortunately, we just haven't had the language, but also the focus from the medical community to ask the right questions of patients so that, to your point, if there is something that is abnormal, dysfunctional, or painful, patients can start to articulate that and build that language themselves. And so today, unfortunately, we have to be our own advocates in a different way. And I would say at the highest level, if there's ever pain that folks are experiencing, discomfort, things that don't feel right intuitively, that is, the beginning of a conversation with a medical provider. And if that provider is not asking you the right questions, time to find someone else. And I'm sharing that because what we have normalized are so many sets of issues. And so let's even just start talking about what happens, in your teenage years. Obviously, you start menstruating and you can have really severe cramps. Or what we sometimes see from our patients are things that present as chronic UTIs, but it's actually pelvic floor dysfunction. And so there are some really interesting things you can do where you're maybe not solving the root cause, let's say in the menstrual cramp issue, but you can find comfort measures through pelvic floor therapy interventions.
can you tell me more about the chronic UTIs? I have to stop you there because now I'm dying to know, because I have so many friends with daughters who talk about this. And I actually have done an episode on UTIs. And, I'm now curious what you're going to say versus what this MD had to say, because she's an OBGYN by training. And as we know, subspecialists are so critical in our healthcare system because they know the nuances for someone who has more general training just wouldn't have training on it. I'm not saying she's right or wrong, but I'm just so curious.
Yeah, well, chronic UTIs are interesting because sometimes you're not actually getting the culture every time. And so you don't know if there's actually, a bacterial infection, but you can present with symptoms that feel like a UTI, but if they're happening more regularly and you're not getting this set of positive, infection data back, there could actually be pelvic floor spasm or muscular issues that are creating the feelings that are often associated with a UTI. Chronic UTIs can have a similar pain cycle to what happens with painful sex, where maybe there's an initial trigger that, it's an infection, it's a trauma, something that creates that initial painful penetration. But then your muscles and your brain create this pain response cycle where you're actually developing pain preventatively in advance of penetration. And so, pain is often in this brain body connection, which we obviously know a lot more about today than we ever did in the past. And with chronic UTIs, there's not a ton of research. And so I don't want to, speak out of turn from a clinical standpoint, but oftentimes the symptoms of what someone thinks is a UTI is actually pelvic floor dysfunction or muscle spasm. And so if you are someone or your daughter or anyone in your life has been having series of antibiotics again and again and again, and it's not working, that's a point where you could actually think about, like, let me go check out the musculoskeletal system and see if there's anything else happening here where I'm creating that spasm or that tension.
UTIs, it's black and white in that you get the culture, and if it comes back positive, it's a UTI. If it's negative, it's not. So what I'm now unclear on, and I just think this is important for people to understand, because why can't we just all say, can I get the culture?
The culture, yeah. And, I don't know enough about what's happening today with, like, online pharmacies, over-the-counter medicine, but I do know, even in my own experience, I've been able to get UTI medication without going in to get the culture. And it's not necessarily, I've wanted that. And so I don't want to put that back on the medical community. We shouldn't necessarily have barriers to getting that kind of medication. But if it's happening really regularly, that's when you really want to make sure you're getting the culture. On our blog too, we have a lot of resources. So if you're, experiencing any of these things, obviously you can read more. It's all clinically informed, and obviously talk to a medical professional too. And I should note, I'm not a PT, so I am, a highly informed, slightly dangerous business person who cares a lot about these issues. Also, what we see, in teenage years, there could be menopause pain. Not menopause, menstrual pain, chronic UTIs. Incontinence can often start with young athletes. So with gymnasts, with runners, who have really high impact training, but are not necessarily getting full body training around pelvic floor, you can start to see incontinence develop at that age. And it can be really challenging and embarrassing as a young teen to be leaking, during your races, even fecal incontinence too. And so that's something that's very, I don't want to say very common, but increasingly common among, young athletes who are not getting that whole body training and are starting to, leak at the end of a race, for example. And so that's a really important opportunity to say, okay, this is not normal. How do I get that kind of care? And then there are all the issues that could present, depending on, your age and when these diagnoses could happen, but PCOS, endometriosis, kind of earlier presentations of things that will become chronic pelvic pain that, again, are not fully addressed by physical therapy, but you really want to make sure you're supporting yourself with some of the pain management and musculoskeletal interventions, from that early age.
Wow.
And so, yeah, it's basically, right, it's a body part, right? Like, it's your back or your legs. There are so many different things that can impact this set of muscles and this whole system. And so we often think about pelvic floor therapy as great. Like, let me do my Kegels after I have a baby so I don't pee my pants. But it's really so much more than that. And also, tied to orgasm and pleasure as well. And oftentimes we think about Kegels, and I joke and I love Kegels because it's how we've normalized and talk about this issue. But sometimes if you have a hypotonic pelvic floor, so a tight pelvic floor, which is very present in painful sex. So in my case, if you can't lengthen your muscles and release, you actually are maybe not able to have the full spectrum of orgasm, because the orgasm is basically the full contraction and release as well. And so this is not just about pain management, but it's also about pleasure, which, I know is hard for the medical community to wrap their head around, but, is really critical. And I've had a lot of friends who have had trouble orgasming who also then, have some of these other symptoms at the same time. And it's just not something that we are taught, about. And obviously there's a lot of lack of dialogue around pleasure in general for women.
How do we know what the ideal orgasm is?
Well, I don't want anyone to feel like there's an ideal, but
I'm not getting at that, but it's more of like, wow, if I can have more, I'd probably want more. Like, so have I reached the possibility of where I can be if I had a healthy pelvic floor?
Exactly. Well, and I think it's more if someone has felt like, hey, I'm watching these movies, and obviously movies are not the best way to see what an orgasm looks like. But I talk to my friends, or I feel like I'm not having that full experience, or I'm not enjoying myself, or I can't relax. Like, I think a lot of the times, especially I joke about like people living, I was living in New York, and so you're very tense all the time.
Yes.
If the relaxation techniques and kind of relaxing your body are not as intuitive to you, that might be an early indication. And so something just to think about is also, what kind of warm up are you having, or, earlier things are you doing with your partner to get into that state so that your pelvic floor can both fully contract, but then also fully relax.
I think that will be motivating for people to get a healthy pelvic floor. And since you were talking about the Kegels, tell us about misperceptions there, and then we'll dive into other phases of life, because I do think people oversimplify it. And I think on every single episode, we do talk about this. So apologies if you're listening to all the episodes. We cannot underestimate the lack of understanding around Kegels. So share your thoughts, please.
Well, I would love to hear, and I'll listen back to hear everyone else's thoughts too. But, at the highest level, Kegels are a shorthand for thinking about pelvic floor strength, right? And it's the contraction in the context of, as we were just talking about, orgasm, painful sex, even other aspects of just healthy function of muscles. You want to both contract and you want to be able to lengthen and release. And oftentimes, actually, patients who are having pelvic floor dysfunction should not be doing Kegels, because you're overactivating an active pelvic floor that's in a hyper state of tension. It's as if my shoulders are always up and I'm now doing really heavy shoulder exercises, and I never let my shoulders learn how to relax, when I should actually be doing, more stretching and more opening.
Ooh, that's a great depiction. I love that. I'm glad I asked the question.
Yeah. Or even, like the connection between the jaw, the hips, and the pelvic floor are also really connected. So if you have a tight jaw, you're not going to want to do these, not that we do jaw exercises, but it's not like you want to be chewing like really hard all the time. You want to learn how to relax your jaw in the same way that you'd want to learn how to relax your pelvic floor. At different stages of life, strength and, release are more important. So actually we'll talk about, menopause in a little bit. That's when your muscles may start to weaken. So you need to be thinking more actively about strengthening, but not at the expense of length and release and relaxation. And so our clinical team often likes to say the most important pelvic floor exercise is not the Kegel, it's actually the diaphragmatic breath. It's how do you learn how to release and to let go? Because then from there, you can build strength afterwards.
Okay. Oh, I love that. So now let's go on to the next phase.
So, not everyone is going through pregnancy, but for those folks who do, that's probably the easiest and most common entry path into understanding your pelvic floor, because there's no way around it. Even if you're delivering via cesarean, there's a lot of pelvic floor, both strength and impact that can happen there. What I'm experiencing right now at 37 weeks pregnant is a lot of pressure on my pelvic floor, from the weight of the baby. And so both strength and having a strong pelvic floor, strong supporting muscles around the pelvic floor. So I'm able to actually carry the weight of the child without having, massive hip pain or pelvic girdle pain is really critical. But then I think the introduction most folks get is afterwards, right? So if you're delivering vaginally, common things that can happen could be painful sex, often related to tearing or episiotomy, incontinence because of all the pressure that was on the pelvic floor, and then the lack of muscle, activation that you're able to have after giving birth, and prolapse, which is all of these are incredibly common. Incontinence impacts 1 in 3 adult women. Prolapse impacts 1 in 4 adult women. These issues, if you don't get to address them earlier, will persist with you through later stages of life and can often get worse. And so that's why there's been such a focus on the pelvic floor in birth rehab. And, this postpartum, in France, they call it the pelvic floor re-education.
Ooh, I like that.
Yeah. So that you're able to, regain function quickly while your muscles still have that elasticity at younger points in your life.
Okay. And so I would like to bring up the C-section piece because
Yeah.
I wonder how much of a misperception or lack of understanding there is around C-section, and even doing that can impact your pelvic floor. Because I'm imagining, let's say I'm a woman and I know that pelvic floor health is really important and I want to be proactive. Some experts have said even when you're planning to get pregnant, you should visit a pelvic floor PT, even one visit, so they can assess your body, or maybe it was even right before giving birth, to help you understand like the best delivery positions and things like that. But I'm not sure how many people would think about being proactive or having those follow-ups if they've had a C-section or plan for a C-section, because it's like, well, nothing's going through my vaginal canal, so I'm good to go. And it sounds like that's not the case.
Yeah. Well, maybe let's myth bust two things. One is the C-section impact, but also what is the work of a pelvic floor therapist? If you're working with a really strong pelvic floor PT, they're going to actually evaluate your whole body, because really a lot of pelvic floor dysfunction can present as back pain. In the context of C-section, there's a lot of physical recovery that's required to make sure that you heal fully. Unfortunately, it's a massive surgery that you leave the hospital with, and maybe you get a piece of paper, if that. And so I think the idea would be both preventatively, but also so you have a baseline and you know where you're at. But then postpartum, however you deliver, you are able to understand, what are my weaknesses? How can I regain strength safely? How can I get back to normal function and exercise and movement? And sometimes that movement might literally just be picking up, the child, but can be exacerbated if you're already having some weakness or dysfunction. In the context of C-section, you can see patients present with incontinence or prolapse after C-section. And that's because of, either the pressure that was given. Sometimes if you have an unplanned C-section, you're still also laboring for a period of time. And there's many different reasons why that can happen. But I would even say reason number one, outside of the pelvic floor issue, is more you've just had a massive surgery, an abdominal surgery that's, connected to your whole body and your pelvic organs too. And so let's make sure that you're getting that right recovery for you based on whatever is going on in your body.
Okay. That makes sense. Thank you so much for sharing that. And then what are your perspectives about that proactive visit so that you're prepared for the pregnancy and the birth, regardless of vaginal canal delivery or C-section?
I mean, I'm biased, but I've been in PT since about week 20 right now. I started because I was having some hip pain, and if you have hip pain or hip instability, which I'm now experiencing getting worse, obviously towards the end, with the amount of relaxin in your joints, it's really critical to actually learn some of those stabilizing and strengthening actions. And so PT for me earlier on was really around strength and kind of pain management. Usually in the third trimester is when you'll start to do labor and delivery prep, which includes what you were describing. So best positions for labor and delivery, whether or not you're having, an epidural. So even with pain management, there are things you can do to reduce your risk of tearing or episiotomy, which obviously has some implications for your recovery. And the other big thing that I'm working on is perineal massage, which I hate that phrase because it's not a massage. It's stretching. It's, pretty uncomfortable. But it's a way to help prepare your pelvic floor for, the pushing phase and the stretching that happens. And again, around kind of the tearing potential.
Okay.
But ultimately too, what I find a lot of value in for our patients who are maybe hearing about these issues, but there's a lot of fear around like what could happen postpartum, is really starting to also prepare for what could happen. So that way, if you're at home 3 days, 3 weeks, 3 months later, and you're like, oh, I'm leaking or I'm having this heaviness feeling, you only get that 6-week visit, the 15 minutes with your provider. And so you're able to be an advocate for yourself in a much more proactive way. And I hope that in the same way we do screening for postpartum depression or even, depression in pregnancy, we can improve the screening for some of these issues later on. But just understanding what could happen, I think, can be very empowering for a lot of our patients.
Is there anything between pregnancy and perimenopause that I may not be thinking of that we should cover, or is that really the next big stage of life changes?
I would say things that could present earlier in life could also present later. So the things we talked about, incontinence from being a high performance athlete, or endometriosis, PCOS, folks are getting diagnosed really at various stages of life. And so it could be related to maternity, but it could also be related to, just other things presenting. And so the time in which it hits you necessarily is not as, important as just making sure that if you feel like things have shifted or are not right, or, are not in the way that you want to be moving your body or feeling good in your body, that would be a good time to check back in.
Now, you're bringing up PCOS and endometriosis. Are you saying that there's data showing if you have those conditions, there's a higher likelihood of having pelvic floor issues?
Well, there's often pelvic floor pain associated with those
True.
issues, not all the time. And so it's part of the spectrum of symptoms that you could be experiencing. And so we treat a lot of patients with PCOS, endo, chronic pelvic pain that could be related to those, but also, lack of root cause understanding. And so, pelvic pain, because of the lack of research, it's just not well understood what is triggering that.
Mhm.
And even endometriosis, as we know, is so underdiagnosed for so long. Fibroids too could be related to pelvic pain. So there's lots of reasons why someone could be having pain, both internally, but also, in the entire pelvic region and kind of your hips and your low back. And that would be a reason why you might want to get support.
Before we get into menopause, I think
Yeah.
just based on what you shared, I did want to bring up this point as well, is around being proactive early.
Yep.
Because, like, one of the things I've seen in women's health, and so many of us who've started companies in this space, it's hard because we're so deep in it and we know so much information. It's like, why aren't more women proactive? Why do doctors not know this information? And I have found the consistency is that fertility issues and pregnancy are when women suddenly have this, I need to know about my body. And now, with so much in the media, et cetera, about menopause, I think women are so frustrated because they're realizing there's not enough information. So now I think menopause has fallen into that,
Yeah.
category. So those seem to be the big buckets. And the gap that is really there, which I think with technology, social media, et cetera, coming into play, the younger generation that continues to come of age will know to be proactive at the younger ages, but we're still dealing with older folks who don't know the information, being the parent slash doctor. I think it's important before we get into menopause about don't wait. So whatever age you are, that the theme is probably don't wait to get help, because what I'm also hearing from other topics I cover with experts, especially Dr. Jerry Lynn Pryor out of Canada. Oh my God, she's incredible. She's been doing women's health for over 40 years and definitely thinks differently. And she talks so much about things we do or don't do in our adolescence and how it actually impacts menopause and pregnancy and other things, bone health, you name it. So talk to us about, what you've seen. And I know your company is young, but the data I'm sure you're
Yeah.
gathering centrally in your databases and the research that you're doing, you definitely have a perspective on the be proactive and what that means for the different phases of life.
Yeah, it's such an important point and question. And I'm hopeful that it's also shifting for younger generations, especially in the context of period pain. I think that's where social media is really taking off. And you're seeing also a lot of folks talk about PMDD and, the emotional aspects of menstruation, which unlocks the beginning of this conversation. And so it feels like we're shifting. This is making me think, when I was younger, I never did any upper body strength exercises, and I was always running. And I thought exercise for women was basically cardio. And at one point, in my mid 20s, my now husband was like watching me struggle, lift myself up off on a ledge, and I couldn't do it. And he's like, wait, you really can't lift yourself up. And so he got me weights for my birthday. And I was like, that's really rude. Cannot believe you got me a set of weights. But
Fempower Health is pleased to partner with the upcoming Femtech and Consumer Innovation Summit. The summit is the latest deep dive event, part of the Women's Health Innovation Series, looking to tackle this growing sector of women's health, having had continental success in driving innovation, investment, research, and partnerships in traditional women's healthcare by bringing together critical stakeholders. Join us in New York on June 7th and 8th as we channel this success into the consumer sector of women's health. Visit www.femtechconsumerinnovation.com to view the superstar speaker lineup and enter code FEMPOWER15 for 15% off your ticket. Hope to see you there.
I forgave him for that moment, but I actually am really grateful because it shifted my perspective of strength and, what women need at different points. And obviously today, I think the concept of women just, doing cardio for exercise is, in the past, but we're in a similar kind of shift, in the way that fitness has shifted for women. So is this concept. I'm torn though on the proactive message because I also don't want anyone to feel like it's too late, because there is never a too late. Many people wait to deal with health issues, various kinds, until it's at the point of pain. And so if you're at that point, like it's not too late, there is a path to recovery. I had painful sex for way too long and I'm fine now. And I, have a really great sex life. And there's not like this termination date by which point, you have to have a surgery. Obviously some folks might pressure you to do that. But the proactive benefits are there in that this is a musculoskeletal system. And the earlier we can both strengthen our muscles, learn how to lengthen, but also develop that mind-body connection, that I think is really core. And I'm a big believer in how we rewire our brain's connection to our body. With both my experience with painful sex and with, chronic GI issues, there's such a deep connection. And so much of my recovery for painful sex was rewiring, when I was perceiving pain, before I was perceiving pain, how do I learn to breathe so that I'm actually not triggering pain? And so I just think that the earlier we can connect to our bodies and understand our own anatomy, the sometimes easier the recovery will be, but it doesn't mean that it is not there if you have not had that experience earlier in life.
Do you know how many friends I've spoken to have said that they're in their mid 40s and have never gotten a mammogram because they don't have time to go to the doctor?
This is not unique to women's health issues. I think we're just, obviously I know too much. And so I definitely encourage my friends to intervene sooner. But even some folks on our team, right, have been having some issues that they are not coming in for. And I was talking to someone last week about it. And there's also fear, right? This idea that it's a very intimate, or it can be perceived to be an intimate intervention. So to break a myth, you don't have to necessarily have an internal exam to have pelvic floor therapy. With virtual care, you're not, putting the computer down there. So there's ways that you can get support and information without having to be uncomfortable on day one, which I think is really critical given what we know about trauma and sexual trauma among women. And, sometimes that could be a big barrier for folks.
So I have a couple questions around if PT doesn't work and all that stuff, but I want to get to that at the end because I do want to get to menopause and we can conclude on that part. So talk to us about what we should expect in menopause. And by the way, I want to announce, and by the time this episode goes live, I'll be a few months in. I am officially in menopause, or I should say post-menopause, because menopause is one day, but I have reached it and I am feeling fine and happy.
Great.
And
yay.
So bring out the candle.
Amazing. Well, mazel tov.
Thank you. So talk to us about this phase of life. And by the way, just to clarify for those who haven't listened to the menopause series, we talk about perimenopause, menopause, which is one day, and postmenopause. Mm-hmm. And so I say this because a lot of my friends will be like, gosh, I'm getting all these migraines all of a sudden and the hot flashes. But some of it, we know is perimenopause and menopause, but some don't. So take a listen to that to better understand the phases. But here, let's just cover from the pelvic floor or the pelvic health aspect.
Definitely. Well, you were already joking about hot flashes and migraines. And so I think the understanding of the constellation of symptoms that you could experience in perimenopause, or throughout and post, are really variable by person. But sometimes what can happen is, particularly with the pelvic floor, you can experience vaginal dryness at a higher rate, which can create, especially painful sex or other tension. You can have vaginal atrophy where your muscles weaken. Like atrophy is, used to describe any part of your muscles weakening, but it can happen to your pelvic floor. And so if you maybe used to be someone who leaked a little, and I'm using quotes, when they, sneezed or ran, that issue can get worse. Or if you've had maybe a stage 1 prolapse that you haven't had at time or were not aware of, and did not address, that could get exacerbated as your muscles and your strength changes. And so when we think about how pelvic floor therapy can support in menopause, it's really a lot of the same issues that you could be experiencing at earlier or later stages in life, but in the context of what else is happening, which could also, include these hormonal changes that make sometimes the recovery process feel more exacerbated. So the plan of care is often quite similar to what you'd be doing, for incontinence earlier, but in partnership with other providers or, depending on what you're experiencing, to make sure you're getting that whole 360 support.
Yep. Awesome. And
Yeah.
I actually did in some of the menopause related episodes, they talk a lot about like some of the creams and things you can use and some of the brands. Obviously, if you're putting anything internal, just making sure you're cognizant of the ingredients and whatnot. So it seems like it's because the hormones have changed so significantly that also taking into account not just the pelvic floor PT, but some of the other support that you can have to aid in what happens with this change of life, right?
Yeah. And there's various different types of providers, but also types of interventions. And so unfortunately today, I think there's still a bit of trial and error of what's going to work for you, but that's true at any point in life with, what goes on with our bodies. But I do want to give a shout out to lube, various kinds of lube, for anything you're using, whether it's for using a dilator because you're, struggling with painful sex, but also for penetration. A lot of folks who I think have a misperception that, and especially, I've heard from some patients of ours that their partners think lube means that, they're failing as partners. And it's really, an amazing part of a toolkit to both have more pleasure, but also protect, and enjoy, whatever is going on.
My understanding also in the discussions we've had is there's lube and then there's moisturizer. And so you can use both for helping with some of the symptoms as well.
Exactly. Yeah.
So what I would look at this as, if I'm hearing this correctly, is having pelvic floor health outside of using like the lube and the moisturizer. It can be around helping with strengthening the muscles in the proper way, and a pelvic floor PT can certainly assist with that. And by the way, for those who can't afford or pelvic floor PT, but also are interested in being able to do at-home devices besides the telehealth, I know there's some things that you can order at home to use to help with the pelvic floor strengthening device. And actually, I interviewed Dr. Allison Shrikande because I called her up. She was a guest on season 1, and I said, I am so overwhelmed by all this at-home stuff, and I'm like interviewing you guys all day long. I can't imagine the consumers who are going on Amazon and are like, what in the world is all this stuff? And so I actually interviewed her to go through all the different devices. The funniest one, I have to say, I don't know if you've seen this, is it's like the Thigh Master. So if you Google on Amazon pelvic floor device or whatever, that comes on. And I'm like, I'm not even a doctor, and I know that just cannot be good in any way, shape, or form. And she did validate that. So if you're curious about that Thigh Master that comes up in your search, the answer is no. That was the only thing she was like, ixnay on that one. But the others, she did give her perspective. So if anyone's looking for that insight, yeah.
No, and look, I am a big fan of any innovation in our space because it's so critical, and we need to have a whole spectrum of options. The one piece of advice or caution I would give, a friend, is to make sure that it's right for you. So in the context of what we said about Kegels, right? Like you could be buying an incontinence device that, is stimulating Kegel training, but if you have a hypotonic or, tight pelvic floor, you might not want to do that first. And so if you don't have access to a pelvic floor therapist, even talking to an OB or just trying to get a baseline to make sure that what you're doing is safe and will not exacerbate your issue, I think is critical, because these devices also aren't that cheap, and so I want to make sure your money is going to good
Yeah,
use.
no, you're right. And she said that too. She says ideally you should visit a pelvic floor PT at the very least one time. If you truly can't afford it, like that is the minimum because you don't want to make a mistake and make things worse because that's honestly more expensive in the long run. So I completely
Yeah,
agree.
agreed. Yeah.
So speaking about the cost, talk to us about like OBGYNs can't know everything. They pretty much know general women's health. And if they specialize in a certain area, go get a fellowship, great. They have more
Yeah.
detailed training in a certain area. But then going to specialists because of the way reimbursement works, thank you, capitalistic society of healthcare, it's expensive. I guess I'm curious if you guys are addressing it, if you have thoughts on how it can be addressed, what
Yeah.
women should be aware of. I just think it's an important conversation to have because I don't want to let it slide. If anyone's listening, like, yeah, thanks for the advice. I can't afford it. What do I do now?
No, I think that's a really critical point. And there's also an access problem because, there's about 40 million women with pelvic floor issues in the US and only about 5,000 providers. And so, and most of those, about 80%, don't take insurance. What we've done from day one is actually partnered with insurance companies. And so our care in person is all in network. We are contracted with the largest commercial payers, from Optum and Cigna to the Blues. And it was really critical for us because of this issue where, I don't want someone to just get one appointment. I would love for them to have a full plan of care, whether that's, 3, 6, 9, whatever they need appointments. And so our average out of pocket for patients is $30, which is obviously still, too high for some folks, but at least is, much more palatable than the 200 to 300 you might be paying in, New York City for an out of network provider. I'd say the telehealth landscape, we're still able to get reimbursed in certain markets. There's some questions around what that's going to look like. And so we're really advocating. And there's actually some really important legislation right now that's sitting in Congress that I hope is going to get reintroduced in the new year around pelvic floor therapy being covered by Medicaid. Because especially when you're talking about birth, so many patients are on Medicaid, and right now coverage is very, very limited for pelvic floor therapy. And so this could be a game changer in the way that, doula coverage or lactation coverage has been shifting in the last few years. And so I'm hopeful. It's still, I think there's a perception that this is niche or a nice to have. And, if any policymakers are listening, it's not, it's a must have. It's part of, our core health. And in the way that PT is used to prevent so many other surgeries, in other contexts, we're seeing, especially in older age, one of the number one reasons women end up in assisted living is incontinence and the risk of falling later on in life. And this can be treated, right, with pelvic floor therapy.
One of the things that I'm really passionate about is really starting to centralize all of this valuable information because it's kind of like if you don't know what's out there and don't know where to look,
Yeah.
you're probably not going to find it. And I know that, like, for example, for menopause, there's NOMS, there's ISHWISH for sexual health, obviously ACOG for general
Yeah.
OBGYN. Is there a group like that for pelvic health that's helping lobby in Congress, or is it left up to these femtech companies and pelvic floor PTs who are already so busy trying to help educate Congress? Like, what's going on there?
So there's the APTA, the American Physical Therapy Association, has a section on pelvic health, and they're doing some great work. There's also an organization called Herman and Wallace, which is one of the larger training and educational organizations for helping folks specialize. I guess from Origin's perspective, I've always been a big believer too in the power of brand and the power of, activating consumers. And so we're, a small company, but have quickly become the largest player, in pelvic health PT across the country just in the last few years. And so we're really trying to use our platform too to help elevate these issues, really one patient at a time, because what we see too is once you go through this, especially if you've been suffering in silence for so long, you're about to start shouting from the rooftops. So how can we think about, all of these patients who've been, shifting their own body identity, their perceptions of self, and how do we build that community to rise many more boats?
Let's talk about surgery. So I know that your specialty is not surgery, but let's face it, there will be cases where a woman needs surgery. And so I know we're not here to talk about who needs it, how to get diagnosed, et cetera, but just any comments from the lens that you have around those who may need to get surgery.
Yeah. If you are getting recommended surgery and you haven't had the option to try non-invasive options before, whether that's PT or other modalities that are appropriate, I would always push back and ask for that first and, have the conversation with your provider. But if it is needed, and that's often needed in, more complex stages of prolapse, chronic incontinence, things like that, are resistant to PT and other interventions. One, making sure you have a provider you trust, but that also you ideally have a PT to support you in your recovery. Because the data shows that having physical therapy as part of your recovery from surgery, particularly prolapse surgery, can improve your outcomes of not needing further surgeries later on too, kind of the repeat procedures. And so that's something to think about, which is not just what is this acute intervention going to look like, but how do I make sure that this lasts for me?
So wonderful. So anything we missed?
If you're experiencing any of these issues, again, like no shame, don't feel bad about it. You've probably been, part of a massive system, especially providers who are not asking questions that help you understand yourself. The first step is really just understanding your own anatomy. I think there's so much power of education as a healthcare intervention. And that's why virtual care is so effective, because at the end of the day, you don't necessarily need manual therapy to recover. Sometimes it's actually, understanding your own anatomy, strength, and exercise, from the comfort of your own home. And then finally, if you find providers that are not working for you, this is a relationship at the end of the day, whether it's with Origin or someone else. And so don't feel like if it doesn't work once, it's not going to work. And so just making sure that you're your own advocate.
Anything that you wanted to share that maybe you didn't cover today? Because I think the work that you're doing is so important. So just in case there were any looming points that you wanted to make.
Well, maybe just in a nutshell, and thank you. Origin is the leading provider of pelvic floor therapy and full body PT, and we specialize in supporting women through every stage of life, from sexual health in your teens and 20s through maternity and menopause. We are focused on treating folks with vaginal anatomy, so that could also include individuals going through transition too. And in some of our clinics, we're able to support more broadly. And ultimately, our mission is to change the standard of care so this becomes far more normalized and covered by insurance and accessible. And pelvic floor dysfunction is as common, if not more common, than seasonal allergies. And so we need to have a lot of work to get this, increase access to this care.
Absolutely. And then would people just go to your website and they'd be able to select a location or basically select what they need to be able to get the care that they...
Exactly. So the website's theoriginway.com, and we have both in-person care, but also virtual care, which is great.
Well, thank you for doing what you're doing. And it's really great to see the evolution. And it's heartening to see how quickly you've grown, because I think it shows the need, but also that people are really catching on that this is something that should be supported. And so thank you for leading that way, and all the best with the new baby.
Thank you. Thank you so much. Yeah, we'll see. It's funny, if it makes anyone feel better, I feel like I'm so not the poster child right now. And I'm like, I'm not doing my stretching, all the things, but life is life. And so we've got to be kind to ourselves. And thank you for all the work you do to amplify these really important topics.
Well, thank you so much. Thank you for tuning into this discussion on the Fempower Health podcast. You can refer to the show notes for links to information that is referred to in this episode. And if you like this episode and found it timely and valuable, please take a moment to tell a friend or a colleague about Fempower Health. And right after this episode is over, please think of one person who might find this episode helpful and tell them about it. And if your friend is new to podcasting, please show them how to subscribe to our show. And another way to support Fempower Health Podcast is to leave a review where you listen to podcasts. And as a reminder, the information shared by Fempower Health is not medical advice, but for information purposes to enable you to have more effective conversations with your doctor. Always talk to your doctor before making health-related decisions. Additionally, the views expressed by the Fempower Health Podcast guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. See you next week. Thank you for joining us on another enlightening episode of Fempower Health. No matter where you are in your journey, our website is brimming with content tailored to your specific topic of interest or life stage. Dive in and discover the resources and insights waiting for you. Your voice matters to us, and if you found value in this episode, please take a moment to write a review. Your feedback not only helps us improve, but it also helps others discover our podcast. By spreading the word, you're empowering women everywhere with the information they need to navigate their unique health journeys. And if this episode resonated with you, please don't keep it a secret. Share it with friends, loved ones, or anyone you believe would benefit from the information. Together, we can create a world where every woman feels supported, informed, and empowered. Remember, knowledge is power, and Fempower Health is here to guide you and support you in every step of the way. And as a reminder, the information shared by Fempower Health is not medical advice, but for informational purposes to enable you to have more effective conversations with your doctor. Always talk to your doctor before making health-related decisions. Additionally, the views expressed by the Fempower Health Podcast guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Until next time.